Sutherland, naturopath and FX Medicine Ambassador. We are here at the 2024 NHAA Herbal Medicine Summit, and with me is the lovely Dr Janet Schloss. Welcome.
Thank you so much for having me.
It's an absolute pleasure. Now, you have been speaking this weekend and you've been on a panel and you've been talking about cannabis and cancer. Can you give us some insights of what you spoke about?
Yeah, it's quite a varied discussion because obviously that's a panel, and there was big discussion about running clinical trials and driving, obviously if it has a THC component and stuff like that. So that was one of the big type conversations. And what we do find in a lot of our trials is that if it has THC, then a lot of people, if they can't drive, they don't want to be part of it. The good thing about, I guess, conducting certain trials in cancer, especially brain cancer, a lot of them don't drive. So that's not as big a deal in regards to this particular sort of cohort. But I think one of the areas we did touch on, which I think is actually really important, is that what we're finding now in research is that there's particular cannabinoids like CBG that actually has been found to be of benefit for people with gliomas. So we've now isolated things. It's not about THC, it's not about CBD, but we can have a plant that has higher amounts of this particular cannabinoid that can be quite specific for brain cancers. And at the moment, it was identified in Israel. It's been done in like tissue samples, it's been done in animals, but there's no human trials yet. And we really want to start looking at conducting human trials with this particular to see if it actually has an outcome as well. Because we did my brain cancer one, it finished in 2019, but we followed them up for 2.5 years to see like if they stayed on cannabis and how they actually did. Well, all but 2 of them actually stayed on cannabis, and 2.5 years later, 47% are still alive. So in a cohort, and that means like 4.5 to 7.5 to 8 years post-diagnosis. Now, this is a cohort which usually has a 12.5% survival rate over 18 months. So to actually have a 47% survival rate for that long compared to the normal things, this is worth investigating and like doing more trials. So as we said, like most of the trials are about symptomology and stuff like that, but I think that we have an ability to have as an adjunct treatment and potentially as a preventative.
I think that the specificity of that is incredible. And the more we learn and the more specific we can be with this, the more powerful the results. I mean, is this getting much government awareness or much funding in this space for this kind of work?
Not at the moment. And that's one of the reasons I've been doing a lot of talking about it from there, trying to get funding, trying to get awareness and break down that stigmatism that cannabis still has, particularly when we're looking at policy and like the government and stuff like that. They still have this level of that's recreational.
I think the research, but not just the research, but treatment options to be that individualized. I mean, it's mind-blowing about where medicine could be in the next sort of 10, 15 years.
And using natural products to assist that as well, not necessarily always drugs.
Yeah.
You know, I think that's the most important thing as well. And one of the things that we want to look, you know, they do the first-line treatment, they finish their monthly temozolomide, and then they don't get anything. So they then do 3 monthly MRIs. They're sort of left. If we can work with them for products that could actually help, because obviously these come back, they're recurrent, to actually help prevent the growth, wouldn't that be amazing? And we could actually change that 12.5% to closer to that 47%. Like, there's been no change in glioblastoma for their survival rate or their treatments in over 3 decades. So, you know, people get diagnosed and they get this horrible diagnosis. The same thing with DIPG. I reckon that we can change that.
Well, I think that the future is looking very bright with someone like you championing this treatment. So thank you very much for all your work. Thank you for joining us today. Don't forget to follow us on our socials and head to our website for all the information we have there.